We alive. Wow. Ladies and gentlemen, you're once again welcome to the King Dems Podcast. And I have with me today a very, very special guest. This man is a practitioner of a profession that I want to become in future. Please make welcome Dr. Hamza. How are you, Dr. Hamza?
I'm good. I'm good. Thank you very much, Ademola, for hosting me in this podcast. I'm
Wow.
very pleased to have you on.
Of course, I am very, very elated having you on board. And, growing up as a Nigerian kid, most kids had that dream of becoming a doctor. So I would say you're living our dreams. And I very much appreciate healthcare professionals. You guys are at the top of the ladder, top of the food chain, for me, in my opinion, when it comes to service to humanity. So thank you for the great work that you do. You're highly appreciated.
Thank
Thank
you
you
very
very
much. I
much.
appreciate that. Appreciate that.
Okay, so Dr. Hamza, you have an inspiring journey across multiple countries and surgical specialties. So before we deep dive right
Yeah.
into deeper conversations, so tell us what's one unexpected or funny moment you have had in your medical career.
Funny moment. You mean in a clinical setting or just my interaction with my patients?
Wow. Interactions with patients.
Yeah. Sometimes the patients can be funny. Sometimes you'd ask patients to do certain things and you do the opposite, or
Wow.
you tell them the importance of what they need to do to get things done to improve their health, and they give you a reason why they don't want to do it. So I find that funny. So yeah, so these are the funny instances, I guess.
Oh,
Yeah,
wow. I think that very much aligns with something that happened yesterday to me. So,
yeah,
the last guest on this podcast is actually a doctor, and she specializes in public health. And
yeah.
then I posted a short, right, a reel on Instagram on one of the medical tips she was giving the public. And guess what? Somebody replied to me on Instagram and said, "No be you go tell me wetin I go do."
So that's an example of what I was
I
telling you.
guess
Yeah.
I guess this is one of your patients. I guess
No,
you guys have to be patient with the patients, right?
exactly. You need to be double patient with
Wow.
it.
I don't
Loads of patience. Yeah, yeah.
at this
I
point I
mean,
don't think I
yeah.
want to be a doctor again.
So it's human psychology, isn't it? Like you find all spectrum of the society
Mm,
in one room. So
mm,
everyone from, let's say, people from high skilled professionals
mhm,
to people in the lower scale of the society. So you
mhm,
find all spectrum of people. You find health conscious people and you find less health conscious people.
mhm.
So you find both ends and you do find middle grounds in between them. But yeah,
Oh
that's
wow.
the healthcare profession for you.
Okay. Anyways, I'm going to reveal a secret to our audience, right? So, Dr. Hamza is actually a good friend of mine, and like he said, health conscious people. He is actually very health conscious. There was a day he was actually coming to my place, and I told him, Dr. Hamza, can you please get me Coca-Cola? And then I was happy that my Coca-Cola is on the way. Only for him to come and he bought, juice and he bought Coke Zero. I was like, what? Doctor, I don't like Coke Zero. I like the original one with the sugar. And then he was like, oh,
Yeah.
this one is better for your health. And then I told him, is it your health?
Yeah,
What is your business? This is my own health.
because he insisted he wanted Coke. I thought, well, Coke Zero is a better version of the original Coke that has loads of sugar, even though both
Well,
do have sugars. But
well, but you guys
yeah,
are
they're not.
usually trying to look
Yeah,
out for us. But it seems like some of
yeah.
us don't want to look out for ourselves.
People don't listen. I tell you, like it's a habit. Habits die hard. You know,
Mm-hmm.
it's very hard to get rid of habits.
Oh, wow.
People are not willing to pay the price until it's too late. You know, once they start having chronic conditions, when they start hitting the road, like, that's when they start hurting their health. They should be more conscious of their health. It's too late. Yeah.
But of course, calories in, calories out. For a person like myself who's got
Yeah.
sweet tooth, I always ensure to exercise, right? A minimum of 30 minutes a day. I hope that actually makes up for consuming sugar.
Is exercise plus diet.
Exercise plus
Yeah,
diet.
yeah.
Interesting. I
So
think we're good at that.
yeah. You don't just exercise and eat junk food. You exercise and
Mm,
eat nutritious food,
mm.
balanced
Interesting.
diet, and yeah, that's when um you improve your longevity by doing that rather than
Mm.
eating junk food, which predisposes you to metabolic syndrome, hypercholesterolemia, to name a few.
Speaking of longevity, I
Mm,
think I have this doctor cousin, right? She's always like very, very health conscious, eating balanced diet and everything. But then, there was a day she was driving on the road and there was this heavy duty vehicle that nearly hit her vehicle,
yeah,
and she was like, "Oh, with all of my good diets, I could still die from an accident." So you
that's true.
doctors like to think that diet actually enhances longevity, but
Yeah,
there are
there
other
are why
variables.
not? There are other
There are other
variables
variables.
like accidents that you can't have control over. Yeah, some accidents are preventable, others are not.
Mm,
You could just be walking by the road and then a crane falls on you. It's not your fault.
hmm hmm
Is the fault of the construction workers for not having it properly done or kept up. So then it's faster to fall on you. So these are the things that they're one of the gambles, unfortunates of life. So if that happens to you, then that'll be unfortunate. Then talking about diets, it's something lifestyle is something you have control over.
hmm
Yeah, these variables we just mentioned, accidents, something we don't have control over. I can decide what to eat. I can decide whether I eat healthy. I can decide whether I eat junk. It's on my willpower to do that,
mm.
not these variables you mentioned. It's not an accident. It's willpower. Yeah, that's the
Yeah,
difference.
I think that reminds me of, some things we studied in economics, right? So
Yeah,
anytime you're trying to build an economic model, you have internal variables and you have external variables. So I
yeah,
think I'll compare, the diet and nutrition and all exercise, all the things you have control over as the internal variables, right? And of course, the external variables, you do not have control over them. So I guess you just need to pray. And speaking of prayer, I know that you are a devout Muslim, and would
yeah.
say to you, Salam alaikum, my brother, and Ramadan Kareem.
Thank you very much.
I think Ramadan is one of the five pillars of Islam, right?
It is.
Alongside
Yeah, that's
things
it.
like Zakat and the prayers, Hajj. But Ramadan just started, I think, March the 1st, which is
Yeah,
a few days ago.
yeah,
So Muslims are required to fast from dusk to dawn. Is that correct?
yeah, yeah,
So I would like for you, as an expert and a medical professional, right, to quickly touch on the health benefits. We understand that fasting has a lot of spiritual benefits, right?
yeah.
How about the physical and the health benefits? What are the health benefits of fasting?
Yeah, it helps with weight loss, for example. If you want to lose weight, fasting is a good way to lose weight.
Okay.
By reducing the amount of calories you eat in a day, you lose weight over time. Helps with improving your metabolism. It metabolizes better when you fast. And also fasting helps with reducing inflammation in the body because
Oh,
eating different sorts of food will cause inflammation generated by free radicals at the cellular level of metabolism. Then that can have damages to long-term consequences. So fasting can help reduce inflammation and also improve insulin resistance in people like diabetes, for example. With blood sugar, it helps with that during fasting. And what else do I want to say? So when you fast, you don't eat a lot of oil and all that kind of in our diet in Nigeria, for example, we have a lot of oil in our diet. So
yes, that's very true.
cutting that during
That's
fasting
a
will
lot of
reduce the
cholesterol.
amount of they will reduce the amount of cholesterol
Okay.
we eat in a day. Bad cholesterol because we eat, which is not good. Uh, it's heavy, it's an unsaturated fat, and it's not good.
Oh, wow.
That's
Speaking of
addressed it.
palm oil, I kind of noticed that lately when I eat foods that are heavy with palm oil, it tends to give me, would I say, heartburns. So is there like some sort of correlation between palm oils and the propensity to have heartburns?
I'm not sure about that, to be honest. What I do know that is an unsaturated fat, which is not good for the vessels. It just goes into the vessel and clogs it.
Oh, wow, that doesn't sound good. But I have a lot of Muslim friends, right? And
Yeah,
I like to think that some of them do not, would I say, do not fast the right way or do not eat the right way. Because when you're fasting, the body tends to experience an adjustment, right?
yeah.
So, what kind of foods would you advise, for I know when breaking the fast in the evening is called the iftar, right?
Yeah,
And when starting the fast in the morning, before dawn, it's sahur. Is that
sahur,
correct?
yeah.
Yeah, so
Yeah,
sahur
that's
and
correct.
iftar. So what
Yeah.
kind of uh dietary choices do you think are suitable for sahur and iftar? Because a lot of people just, they just load a lot of carbs, a lot of like
Yeah, yeah.
different
That's not
things.
really good. You need balanced diet. That's all you need. You don't need
Okay,
loads of carbs. You need balanced diet. Yeah.
okay,
But at least,
wow.
but carbs will help you maintain. It takes time to digest, so
Yes.
you have it. Yeah, so it's able to sustain you over a period of time. You have a lot of time. But then the side effect is you are putting more calories into your system.
Oh, wow.
So, which if you're trying to lose weight, I mean, then you're taking in lots of carbs and you're doing the opposite of what you're supposed to do, which is lose weight during fasting, but then you're gaining weight by taking in lots of calories, which is what
Mm.
carbs do.
Wow. I remember when I
Yeah,
when I
so
was in university, so I had this Muslim roommate. So he used to say something in Yoruba. He says "Ẹni tí ò bá gbọ́n làwọn ń gbò," meaning a person that is not wise is the one that the fasting, would I say, has like a negative impact on,
yeah.
because a lot of people feel drained during that fasting period. And I think there are techniques to manage your energy levels, especially if you're doing work that is highly mental or highly physical. But for this
Mm.
guy, he used to eat stuff like, he used to have like a lot of bread and beans in the
Yeah,
so he used to eat a lot of heavy food.
just to sustain himself for the day.
Yeah. So
So if
for
your goal is to lose weight, like I said, if your goal is to
Mhm.
lose weight, um, you shouldn't eat those kind of food. But if your goal is just eat and anyhow you want, it's up to you. You know, if you don't want to be healthy, it's a chance to be healthy too. You know, you can't just
Mm.
eat in the way you want. Um,
Yeah, but some people
you,
are like would I say long hours of work, right? Even during the Ramadan period, and it sort of affects their energy levels. Is there anything people can do to like manage energy levels and still be able to live a healthy life while working during this period?
yeah, with Ramadan, to be honest, is energy draining and stuff because you're
Mm-hmm.
not eating, so
Mm-hmm.
you'd be low in energy either way.
Mm-hmm.
So there's no
Mm-hmm.
magic pill for it, I think,
Okay.
to bypass it because you're not eating during the day would affect you.
Mm.
Yeah, there's no cheat code for it.
Okay. Wow. Interesting. Well, I guess
Yeah, there's no
people's
cheat.
bodies tend
So
to adapt over
people
time.
are affected, and people are affected differently as well. Ramadan.
Yes. Yes.
Yeah, people are affected. If you have high metabolism, then you can digest food faster, and
Mm-hmm.
then you don't have, and then you get hungry. Yeah, so you can't help it because that's how your body works. So,
Wow.
so one of the spiritual lesson of Ramadan itself is to teach you patience.
Oh.
Yeah, so it's patience, so you have to be patient. There's lots of people that don't have food to eat as well. So
Mm.
they have to, not eat the entire day and don't want to give them food. And then they don't know where the next meal is coming from. So there's a patience from that side as well. If you look at it. So yeah,
That's quite tough. I guess I would say patience and perseverance as well.
and perseverance, yeah. But
Yeah. Mm. So, speaking of your global experience, right, your journey has actually taken you through different healthcare systems, and the World Health Organization estimates that 5 billion people lack access to safe, affordable surgery and anesthesia care. So, based on your own experience, what are the key barriers and how can we improve access to quality surgical care globally?
Right. So I think is number one thing would be priority by the stakeholders, those in charge. So different countries prioritize differently. The World Health Organization will say one thing, but then the priority falls in the hand of the stakeholders or government, in fact, or the country. Say, for example, in Nigeria, the priority would be to spend money on health, education, and what else? Infrastructure. But then, if the government does not prioritize health and investment in surgical equipment and access to affordable surgery, then you don't get it. So it's a problem in the major developing countries and the developed as well. So it's more to do with the stakeholders rather than those in charge, rather than what the World Health Organization stipulated people to have. Say, for example, in the United Kingdom, as well, you do have things that are missing. For example, NHS underfunded, well, relatively to Africa. NHS is doing way better than a lot of African countries in terms of
Mm.
access to affordable operations and healthcare. So relatively, of course, it's not a fair comparison because UK is a developed country and Africa is developing, but we can still do better. There are countries that are trying to be, Rwanda and other places, because they have good governments that are investing in people. So the same thing can be applied across Africa and other developing countries, South America, India, and the rest of the world. It's all about priority. The NHS gets deprioritized as well because the government will fund things that they're not prioritizing. They focus on certain things that are not really important when the house is burning, i.e., the NHS. That's not a good thing.
So
Yeah,
I see you doctors and other health practitioners very, would I say, upset about the rationing of resources on the budgets, right? So I studied economics for my first degree, right? And
mm,
I have been a finance professional for some time now. And I can tell you for free, it is actually not as easy as you guys think.
yeah,
When it comes to the apportionment, right? There are a
yeah,
lot of things that are pressing, and of course, in terms of the allocation of those resources, there are
yeah,
certain decision making models that are utilized, right? And
mm,
aside from the decision making models, also the influence of the relevant stakeholders as well comes to play. So I think it would be nice to have more powerful lobbyists, right, within the healthcare system in order to be able to get more government funding, and also as well, internally generated revenue would be very, very good within healthcare systems in order to help improve the healthcare systems. And aside from internally generated revenue, you could also partner with some of this, would I say, charitable donor organizations. So, like when I was in Nigeria, I did work with the CRS, that is Catholic Relief Services, and we did have a number of grants, healthcare related grants. So I did work with Global Fund Malaria. There was Global Fund HIV, Global Fund tuberculosis. Bill and Melinda Gates Foundation, for example, they helped with the eradication of polio in Nigeria alongside the Rotary Club, which I'm a member. I am a Rotarian as well. So basically, if a certain, would I say, diseases or medical conditions, right, are actually prioritized by the relevant stakeholders, maybe regulatory stakeholders within the medical system, you guys could also like access funding from grants, giving bodies. I think that also helps alongside using what the government actually provides. But for you, in your own experience, right, what policies or innovations have you actually seen that have helped to effectively improve surgical care accessibility in any of the countries that you have practiced in?
Yeah, I think it's more to do with a valid point, but I think the more it's more to do with integrity of the government.
Hmm.
So I keep going back to Africa because that's the focal point.
That is our
Uh,
home.
it has the focal point because if the governments are not, they say one thing in their manifestos, and then once they get into power, they do the opposite. That's something that needs to be dealt with. It can't go on because Nigeria is having a mass exodus of doctors leaving the country because they don't have access to high class equipment for an operation, and
The brain
they
drain is
imagine
massive.
the brain drain is massive, and it's not a fertile ground to have medical professionals practice. So that's not good. And that's why the government are trying to restrict doctors from leaving the country. But what are they doing to revamp that, to bring them back into the country, to stop the outflow of doctors? You can stop them, but what are you doing? So that's what I don't know. That's something that needs to be looked into, I think. Go on.
Wow. So you medical professionals have to adapt to limited resources, especially in low income settings. So how do you tend to achieve the medical goals that you strive or set out to achieve, even with limited resources? How do you guys cope?
So I haven't practiced in developing countries. Most of our practice are in
Hmm.
Europe and the
Hmm.
UK. So in Europe, you've got all the equipment you need. Standardized means all the countries have similar, if not better, equipment than each other. Roughly, the small differences you find between countries in Europe
Hmm.
in terms of spending, affordability of certain equipment. But you can do any kind of operation you want to, and
Hmm.
you have everything in your fit, at your fit, to perform that operation. Just like here, it's the same thing. So there wasn't any challenge that I found, to be honest. But the main challenge would be for you to, dedicate the time to learn from that. So learn the procedure, learn how things are done, and then take it where you're from. You take it back to your home country.
Hmm.
So and then one thing would be for the government to find ways to draw back these people that have left the country, train abroad, and is a way of trying to woo them back to the country. That is a challenge now. Why? Because doctors will fear that they've been practicing in developed countries and they don't have enough. They don't have the same quality of equipment or
Hmm.
facilities that they used to practice at home. So it still goes back to the government now that they need to spend more in healthcare, equipment, in everything healthcare related to prevent medical tourism and mass exodus of doctors or healthcare professionals abroad to Western countries. So you train doctors and export them. So
Hmm.
like you're doing another country a favor by training doctors and then giving it to them. So they don't have. So what the developed countries will have to do is give them certain skill set, training, and then they're into the system and then they practice. So you
I think
basically training,
that's
which is yeah,
that's the whole essence of a brain drain.
yeah.
Basically, you're losing your human resources to another country due to favorable working conditions and remuneration in that other country. There is a statistic that is mind blowing to me. So, according to the Lancet Commission on Global Surgery, 3 million additional surgical procedures are needed each year to save lives and prevent disability worldwide. You are an orthopedic surgeon. What does this number mean to you?
It's scary, isn't it?
And you guys,
Where are these gaps in? And we go back again to the same thing we were talking about. These gaps are in developed countries.
mm,
And then what does it go back into? Lack of funding due to endemic corruption on their part. And yeah, that's what gives rise to these numbers. But if you come back to developing countries, you don't find this stuck in gross numbers. It's not a big margin like in developing countries or underdeveloped countries.
mm,
So we're going back to the same thing I was talking about, lack of funding. Yeah. So it's not something I can only try my best. There's I've just got one life to live, so I can only try my best and influence government policies by speaking up
mm-hmm,
about these things. And once I get the time, I can go on, do certain operations, teach, and also if I get the chance to speak about these things in a public setting, that would be good.
and
That
of
would be
course,
my plan in the future.
that is why you have this platform, the King Dems Podcast.
Yeah.
We set out to achieve that impact, a positive impact in society, right? And we have, wonderful professionals like yourself, pour or touch light on this very key hot topics, right? And hopefully, we hope that the relevant, stakeholders are going to pick this up and action these recommendations. So, there's a mindset about doctors that you guys are superheroes. Doctors are also human beings like
We're also
ourselves.
human beings. Speak that
So,
loud.
the surgery and emergency medicine are really high pressure fields. So,
Yeah.
what actually helped you handle extreme stress, particularly in trauma and emergency cases?
So I find that exciting. Every time I see things like that. I'm not distressed by it. It doesn't affect me.
Wow.
I don't feel bad about it. It's because I love it. Because I love what I do. So it's not
Mm,
like a chore for me. It's like
mm,
going and having fun.
mm.
That's how I see it. Learning as well. Learning is fun. So yeah, that's how I see
Wow.
it. It's a mindset shift. So for people that are not passionate about it,
Yes,
will find that
it's
bothersome.
it's going to be a lot. It's really wonderful when you're passionate about something, even if it's high pressure or highly demanding. It won't
Yeah.
feel like a job to you, and it's wonderful having individuals like yourself that are passionate about service to humanity. And I always like to tell people that the greatest sum of leaders are actually the servant leaders. uh you are a religious person. uh I am a Christian, and in Christianity you have seven leaders like Jesus Christ, right? And in Islam, Prophet Muhammad was clearly a seventh leader. So regardless of your religious affiliations, you'd see that the people who have been respected over time and who have actually achieved great influence and impact in life
Mm.
have always been servant leaders, right? And that is one of the reasons why I really place a lot of premium on healthcare professionals. Trust me,
Yeah.
you guys are overworked, underpaid, underappreciated, but I
Yeah.
want to give you your roses, give you your flowers, give you appreciation, right? To every healthcare worker out there, much love and respect to you guys. Thank you for the work, the hard work you guys put into save humanity. On behalf of the patients and impatient patients, I am telling you guys, thank you very much. God bless you guys.
Thank you very
You
much.
guys, you're welcome. You're welcome, and of course, you're always welcome. So, you guys, tend to have a lot of burnouts, right? Medical
Yeah.
burnout is a growing crisis. So, with a study from JAMA showing that 62% of physicians reported experiencing burnout in 2022, what are strategies that you recommend for managing stress and avoiding burnout in healthcare?
In a year, you have annual leaves.
Mm-hmm.
So this is one way you can make use of to reduce burnout. So if you want to reduce burnout, take advantage of your annual leave, take time off work. You don't have to keep working back to back.
Mm,
And the sign of even some people will see sign of burnout like lack of focus, they're not eating well, you see their minds all over the place. They still want to work because they think, except for example, you have a toxic working culture in certain places where
mm,
showing up at work every day and doing extra, staying overnight and then doing extra will be seen as hardworking. But what you're doing is you're killing yourself. You don't get paid for that thing you're doing. So it's
mm,
I mean, you get paid for your salary, but you're staying longer than you should, then that's not good. Or not taking advantage of your annual leave or study leave, to take out time off work. These are very bad ways that you can, hurt yourself by, inflicting burnout syndromes, like you've seen around NHS. I see lots of people will just spend extra hours because doing that will make them look like superheroes, or or make them look. People will have a perception of them as being hardworking, and then so what? You're not eating
mm,
well, you're not sleeping well, you're doing extra. So, and it's not medicine is a journey. It's not a marathon. You're going to spend. Let's say you're at the start of your career now. You're going to have another 30 years to spend. So
mm,
you don't want to kill yourself in the first 2 years by doing extra, trying to, prove yourself to people that don't even care. So the person that's going to be hurt is you.
mm,
So I guess that's one way why people get stressed, burnt out. Another one would be, there are many exams. People have got personal lives outside of work as well. They've got family, they've got this, they've got that. These are one of the things that can, drain you as well while at work. So having a balance by taking time off work is a good way of trying to keep a healthy balance and not get burnt out. Find a hobby, go to the gym, whether it's cycling, swimming, other people have different things. Don't just finish work and go home and then sleep and then wake up and then eat and then doing the same thing without exercising and releasing your stress by, interacting with other people too. If you have friends, chill out with them, go places, have fun. But
mm.
other people prefer to, be in an enclave, and then that's when you have the effect of stress, burnout. No one to speak to, just by yourself, and then you're not having hobbies, just a secluded environment. That's not really good.
So
Yeah.
I have a lot of friends in healthcare sector, and I like to joke with them. I tell them, you guys are just involved in shifting cultivation, because a lot of these guys in healthcare like to take extra shifts. Extra shifts.
Definitely.
Some people love extra shifts even more than their partners, their boyfriends, girlfriends, or something. They love for extra shifts, like that extra money. I don't understand. It's actually very
It
tempting.
comes,
It's
it comes
probably
with human
addictive.
nature. It comes with human nature of greed. You want to have as much, you want to have money, but then one, these people are not even having time to
Hmm.
rest,
And some of them tend to
eat.
break down real bad
Yeah, they
at
break
some
down
point.
real bad. They collapse.
Hmm.
That's why you see some of them collapse. You see somebody die. No one knows the cause because they're doing shits back to back.
Mm,
Why? Because they want extra money. But you're
mm.
seeing, just like I told you, it's a long-term game. You're going to be doing this for 20, 30 years. The money will come. I mean, you don't have to get everything 1 year. No,
Mm.
you don't have to get everything 1 year. But that's the mentality.
They want
Yeah, they
everything
create
now.
exactly. They want everything now. Yeah, they want everything now. So if you want
Mm,
it now, then you're paying the price for it.
mm.
I.e., burnout, um, metabolic syndrome, you're not eating well, doing a lot of night shifts because you want to cover. I don't know what they do. Like you do a lot of night shifts. Night shift has effect on you, shorten your lifespan. There's an increased risk of breast cancer with night shifts.
Whoa.
Yeah, so yeah, your sleep cycle gets
That's
disrupted. You don't have a good sleep cycle, and
yes, that
yeah,
one is very, very real.
your
and
circadian
it
rhythm
becomes
just gets
difficult.
disrupted, and then you have to. It takes you time to come back to where you were, to baseline.
Yeah,
That's
well, it takes the body some
yeah,
time to
yeah,
adjust.
time to yeah.
Wow,
So
but
yeah, I
what
see.
role does mentorship and peer support play in overcoming burnout cases?
Peer support is like I said earlier, having somebody to talk to. If you're having a problem, you say it to anyone. You're taking it off your back. So
Mm,
rather than keeping it to yourself, not talking. Even talking is a therapy.
exactly.
You have
Just
somebody
letting it off your
listen to
chest.
you. Yeah, listening off your chest and having somebody listen to you is important. Even if they're not doing anything, for them to listen, it's good. So that can help you with that can help with fighting burnout, relief from the pressure that you have in your chest.
Mm.
Yeah,
So, for aspiring doctors and surgeons looking to
yeah.
follow in your footsteps, what are the most important lessons you've learned in your own career?
It's to take things one step at a time, I think, and
Mm,
not be overwhelmed by many things, and taking time off work, enjoying what I enjoy doing, outside of work, not letting work life affect me, spending time with family, talking to family, even if they're not close to me, I speak to them on the phone, and
mm,
spending time with friends, going out, eating good food, exercising. These are things that makes up part of it. Work is life, but don't make your entire life about work. You understand?
mm,
Work should be part of your life, but not all part of your life should be work. You need to give it time. You need to give time for everything. Time for working out, time for family, time for eating, time for this, time for that, and time for work. Not the 100% for work, but you need to apportion it. Certain
mm.
people would just go to work and carry work back home with them.
Exactly.
And is the home to them is an extension of work.
Hmm.
Yeah, I mean, there are certain things you can do at work, at home when you leave. Then, but then don't let that take over your life. That's how I see it.
And I think that actually does affect an individual's mental health as well.
Exactly.
So, for you, what do you wish you knew when you started your medical journey?
That that medicine is a long term game. It's not. It's a, it's not something. It's not something that ends in med school. Med school is not. It's not even the start.
Wow,
Yeah, it's not even the
it's
start.
just the beginning.
It's just the beginning. It's not the end. Sorry, it's just the beginning.
Wow, that's a
So
lifetime of learning and
it's
responsibility.
exactly. It's lifelong learning. It doesn't stop. It just continues and continues till from cradle to grave.
Mm. But
Yeah.
how can young doctors prepare for the realities of working in different healthcare systems?
There's nothing that prepares you for that. You just go in and then swim.
Wow,
you just
that's
you just
it.
go in, but you need to go in there with the mindset of you want to learn. That's it.
Mm.
That's all you need. With a mindset that you want to learn and improve your career. You don't have to compete with anyone. Just be the better version of the person you were. That's it.
So I don't know why this is happening. A lot of countries, even in the Western world, tend to
Yeah,
have a shortage of medical professionals. So there is a disturbing statistic. So from the AAMC, so a 2023 report from the Association of American Medical Colleges predicts a shortage of up to 124,000 physicians in the US by 2034,
yeah.
emphasizing the need for future medical professionals. So, what do you think is wrong with the current system globally that is making the medical profession probably less attractive for people to study? Uh, because when I was growing up, every African parent, almost every African parent wanted their kids to study medicine.
Yeah.
What has changed
Mm.
right now?
It is because medicine used to be a traditional law engineering used to be a traditional pathway for career stability, stable
Hmm.
income stability. There are now new ways of making money. Imagine. So imagine like me and you now sitting and making videos on YouTube. You don't have to do much. You don't have to do much to
Uh,
earn what a doctor is earning. So, so why should I go to med school when I can make YouTube videos or TikTok videos and earn even
mm,
way better than consultants? So
wow.
it's you look at it both ways, but some people do see it as a prestigious, noble profession to follow,
Hmm.
and you still have people going to it. But then, why we do have shortages across the world is because there's no country that has sufficient doctors. There's no country that has sufficient doctors to say we have enough doctors. We don't need normal. A lot of countries still need, even in the United States of America, UK, and countries, Australia, Canada, and talk more of other developed countries or developing countries. The ratios are quite bad. Some countries will be the ratio of one doctor to 2,000 patients, or even worse.
That's
The
that's
world,
that's
yeah, yeah. So yeah, so that's not good. That's not good. There's no country that's got enough doctors, and all countries need doctors. Yeah.
wow. So let's talk about preventable health conditions and public health awareness. So from urology to trauma surgery, you have seen a wide range of medical conditions. So, what are the most common preventable health issues you encounter, and what simple lifestyle changes can people make to avoid them?
For example, urology, if you want to avoid stone formation, it's to drink lots of water, isn't it? Yeah. If you're dehydrated,
Well,
you're
lots of
predisposing
water.
yourself to stones. Yeah.
So, how about lots of juice as well?
Juice, not juice, water. That's what everybody needs.
Okay, let me take a doctor's advice and switch to the
Yeah.
water.
Yeah.
Okay.
Yeah, these are things. These are things that are preventable, and of course, your lifestyle, your diet, and the way exercising. These are lifestyle changes
Mm,
that if you don't tune yourself to, would have drastic effects on your health long term.
mm.
Mm. Yeah. So these are the things.
So, the World Health Organization put out a report stating that 1 in 4 adults globally does not get enough physical activity, leading to higher risks of chronic diseases. So, how does these impact surgical outcomes and recovery?
It does because if you're having bad lifestyle choices that lead you to having diabetes, it means if you have surgery done, your chances of recovery is quite slim.
Mm,
Why? Because of diabetes, you have poor control, especially if you have poorly controlled diabetes, then
hmm
your chances of healing is quite bad. So diabetics are known to have bad um, recovery in terms of healing.
mm.
Yeah. So
So,
yeah, that's one thing.
okay. I actually want to ask, would I say, a question about diabetes. It is quite common, I think, among Africans and Asians, right? Especially as age catches up with individuals in
Yeah,
the African and Asian population. So I
yeah.
have always been curious that the cause, like what is the actual cause of diabetes? Is it a function of genetic, would I say, is it a function of genetics, right? Or a
Mm.
function of lifestyle choices?
It's
What's
both.
the
It's both. It's both. The type one, type two diabetes. Type one is genetic, and
Mhm.
type two is metabolic. These are lifestyle. Type two. So if you look at the
Okay,
lifestyle,
type
if
one
you like
is
genetic,
genetic, okay,
yeah,
and type
yeah, most
two
likely genetic.
is
Type two is more of lifestyle. Yeah,
more of lifestyle,
and
okay.
people with if you see Asian African diet, it's more of lots of carb, isn't it?
Hmm.
Yeah, it's lots of carb, and so you have loads of carbs, loads of glucose in the system. You have insulin being flushed out to control loads of carbs in the body. So with time, you get insulin resistance, and then you develop diabetes. So that's the reason.
So how do you ascertain whether it's type 1 or type 2? Like, what are the
Type,
procedures?
so type 1 is genetic. So the cause is genetic, means you develop insulin resistance. So insulin, you have loads of glucose in the system,
Okay.
but then you're not able to absorb it.
Okay.
You understand? Because what insulin does is absorbs the glucose into the cells via the receptors. So if you have a mutation or genetic abnormalities in the receptors of those genes, you don't get glucose absorbed. Therefore, you have loads of glucose all around floating, and then yeah, that's how you have it.
So is it right to say that insulin is a biological catalyst? Is it an hormone?
Insulin
Like,
is an
what
enzyme.
exactly is? Okay,
Insulin
it's
is
an
an
enzyme,
enzyme.
yeah. Okay, yeah. So enzymes are
Insulin is an
actually
enzyme.
organic catalysts, right?
Yeah, enzyme are organic catalysts yeah, exactly. That's the correct way of saying it. Insulin are made in the pancreas
Okay.
and they're secreted when there's a high amount of glucose. What they do is they absorb glucose into the cells, right?
Okay.
Yeah. But then if you're not having insulin floating around without insulin, what do you have? You have a lot of glucose and then you don't have anything to regulate the amount of glucose in it.
Okay.
That's what happens. It's called insulin
Mhm.
resistance. So
So
you go on.
you can continue. I would like for you to finish up your statement, but I am trying to follow you actively in order to not just educate myself, but also educate the
Yeah.
public on the effects and the impact of diabetes, because it is very, very rampant. And sometimes I get in a cab and with African drivers, Asian drivers, they keep discussing diabetes.
Mm. Is
Like,
is a
everybody really
lifestyle.
wants to know.
Yeah, it's a lifestyle in these communities that's causing it. If you see how we eat, you can tell. Rice, 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 rice. A lot of it. Yeah,
So
that's not good.
there was an Asian driver who discussed with me. He told me he made some lifestyle changes, that he cut down on his carbs. He stopped
Mm,
taking rice for a
mm,
while, and he was taking more of veggies and proteins. And he
yeah,
said that within the span of a few months, he was able to achieve a significantly better bill of health.
yeah.
So from your own end, lifestyle changes would you advise for people that are diabetic?
To exercise more,
Hmm.
change their diet, and you know, before you know it, you start improving with it. Exercise is losing weight as well. Yeah, very important. Yeah,
Mm.
these are all all syndromes that predisposes you to having uh, diabetes. If you have
Mm.
poorly controlled weight, you're not eating well, you're not exercising, you're just there having a sedentary lifestyle. So before you know it, these things will start creeping in.
So,
Yeah,
in the course of this conversation, you've actually emphasized a lot on diet and nutrition, and of course, exercise as well.
yeah.
So, how do these lifestyle choices affect surgical recovery and overall health?
So you're exercising, you are eating well, you're less likely to have diabetes because if you're diabetic, your chances of recovering from the surgery is very low compared to somebody that's not diabetic.
Mm.
So that's why.
Wow. So, according to the CDC, they say 70% of chronic diseases are preventable through lifestyle changes. I
Yeah,
think these actually emphasizes and corroborates with what you have been
yeah.
are hammering on uh, over the course of the past 1 hour. It's really
Mm.
interesting how you guys as medical practitioners tend to give us laymen, useful advice. And I think there's this, would I say, mindset that if the recommendation doesn't sound complex or doesn't involve taking pills, people don't tend to take it seriously. So is there
Yeah,
any form
exactly.
of reorientation that you would like to happen to ensure that people take healthy lifestyle choices more seriously?
It's by talking about it. Just keep talking, and then people that will listen will listen.
A word is enough for the wise.
Just keep talking about it. Normalize talking about health, and then
Mm,
it's like normalizing talking about money. Normalizing, the way we normalize things, health is normalized.
wow. So let's talk about innovations in medicine and, of course, the future of surgery. So, with your experience across multiple surgical fields, have you seen any groundbreaking medical innovations that have significantly improved patients' outcome?
Yeah, I think minimally invasive procedures, be it robotic prostatectomy or robotic
Hmm.
knee replacement. These are things that have helped with recovery because you're not doing a massive incision on a patient to um to treat or remove what sort of abnormality or pathology you want to remove, but then you're using a minimally invasive procedure, and then the outcomes are quite good. So that's what I think is good about innovation and the
So
application in the healthcare setting.
okay, you
Yeah,
touched on robotics, and when you talk about robotics, for me, AI and robotics are quite closely linked. So the
yeah.
use of AI in surgery has grown significantly, right, with the robotic assisted procedures, and it's increased by about 13% annually. So in the future, it seems like we are going to be utilizing, more AI in surgeries. So, what's your perspective on the effectiveness and the efficiency of using AI assisted surgery?
I think that would be good because then you don't have the nuances you get with humans, errors and stuff. So
Mm,
using AI would minimize errors, and then would lead to very good outcome in terms of surgical recovery and efficiency.
hmm.
So
Interesting.
yeah,
So, I think the British Medical Journal, they are in sync with you. They're in agreement with you. So according to the study that they published, so they found that robot-assisted surgeries reduce complication rates by 30% compared
mm,
to traditional methods. And
yeah,
you're happy with that.
yeah. That's a good means we're in the right path. Means in the nearest future we're not going to have any complications at all because these are we are at the infant stage of it. So with time we improve on that. We build on the improvement, the mistakes we've made, and it gets better every day. So the outcome was very fantastic.
Interesting. So, for
Yeah.
you, if you could change one thing about the global healthcare system today, what would that thing be?
What I would change is number one thing, every country, the thing that they should prioritize on would be first health, because if you're not healthy, you won't go to school. Health is basically the health of the country,
Health
which
is
is
wealth. So you guys
which is
say,
directly proportional to how the economy performs, to the well-being of the country. So if the people are not healthy, then the country is not healthy. So the country is poorer. Yeah, there's a correlation with that. So I think if there's anything I need to change is the portion of the GDP or the allocated revenue that needs to go into healthcare should be larger. A large portion should go into, and then followed by education. Yeah,
she said, so we know you're a very busy man, and
yeah,
we have just one more question for you.
yeah.
So, if you could leave our audience with just one piece of health advice, what would that advice be?
It's to stay healthy.
Oh
Be
wow.
healthy. Yeah,
And keep pursuing healthy lifestyle
yeah.
choices.
It's the lifestyle choice, good lifestyle choices, and you thank yourself later.
Wow,
Yeah,
interested. Don't
yeah,
be like the patient that says, "Are you the one that is going to tell me what to
yeah.
do?"
Exactly, exactly.
Speaking of our audience, right? We've
If you're
launched
healthy, then
the
you won't get
merch.
sick.
Yeah,
Yeah,
stay healthy. We've launched the merch, and of course, Dr. Hamza is going to be getting a free copy of this heart. You will be getting a link to the shop very soon, as soon as we make it public. So keep supporting the show so that we can have wonderful experts like Dr. Hamza come teach us about what we need to do for our health, even though it may not be what we like to do.
sure, sure.
So, Dr. Hamza, do you want to give a shout out to anybody before you leave?
Now I'm going to give a shout out to you and then to
For
the entire King Dems team for setting me up to come and, uh,
you
talk
have
about
you
health.
have a
Yeah,
setup.
I'm quite happy. Yeah,
Wow, wow, wow. Thank you very much, guys. So, if you've reached this end, love and respect to you guys. Kindly subscribe, join the channel, show your love, support, share, comment, right? We appreciate you guys. God bless you. It is goodbye from us right now.